Here, I'm running my own slides, so it will take just a second. There we go. So this month we have a couple of assignments for you associated with this session. There's an infographic, an article, and an activity about using plain language to communicate with your study participants. So please take a look at those. Today is actually going to be our last session of this series. We had hoped that we were going to be able to bring you together for a final graduation and networking session in April, but unfortunately, we're not going to be able to do that event this year. However, we are working on some future opportunities for you to connect with each other and with other people around the university. So please keep an eye on your inboxes and the VPR newsletters for more information on that. Now, in the meantime, the previous sessions recordings are available through Canvas through Monday, March 25th. That's this coming Monday. Those of you who have viewed all 7 sessions, either on Zoom or recorded by March 25th, will receive an electronic course completion badge that is issued by the Office of the Vice President for Research that's suitable for sharing on social media. You can put it in the certificate section of your LinkedIn profile. You can put it in your email signature if you want to. A picture of that badge is shown there on the screen, and you can actually you can click on the electronic badge and it'll take you to this page where whoever's looking at your badge will know what you did for it, the various topics in the course session. So it's kind of a nice thing to have on your profile. So please get in there and complete those sessions so that you can get your badge before next Monday. If you're not sure which sessions you have or have not completed, you can see that in Canvas. If you go into Canvas and click on the modules section in that menu on the left-hand side, it'll take you to our modules page, and down at the bottom of the modules page, there's a module called Attendance/Badge Award Tracking. If you go to that section, you'll see that you have a green check mark for every session that you have completed, or a gray circle for any session that you have not completed. So any that you've not completed, then go to that sessions homepage and you can click on the CME link and see those through the weekend and get credit for the entire course. So we encourage you to go ahead and do that. All right, so let's get on with our session. Today's title is Participant Recruitment and Retention. We have 3 very distinguished speakers here today to talk about this topic. Our objectives for today's session are the following: formulating a participant recruitment plan that takes diversity into account, and develop an ethical participant recruitment and retention plan. So as I mentioned, we have 3 very distinguished speakers. We have Amelie Ramirez, who is the chair and professor of population health sciences and director for the Institute for Health Promotion Research. We have Arash Salardini, who is the Clessy Foundation Distinguished Chair in Alzheimer's and Neurodegenerative Diseases at the Glenn Biggs Institute for Alzheimer's and Neurodegenerative Diseases. And we have Devjit Tripathi, who is a professor in the Department of Medicine, the Division of Diabetes. All 3 of these folks are going to give you their best hints and tips about recruitment, and hopefully you're going to get some very good information from all of them. And so we are going to start out today with Dr. Salardini. And so Dr. Salardini, thank you for being here today. Please take it away.
Hi, I apologize for my voice. I've got a lower respiratory tract infection. I'm slightly delirious, but we'll get through the slides together. Can we have the next slide, please? So the first thing to do when you're accepting a study, either you're starting a study for a sort of a PI-initiated clinical trial, or you are becoming a site on a national or commercial clinical trial, a multi-site one, is to see if you are the appropriate site for that particular study. So the 3 things that you want to be aware of are time, numbers, and appropriateness. Firstly, you want to be able to finish the recruitment within the time allotted. This is usually you're given a number of years. Often it's about 3 years. During that time, you are competing with other trials that are happening in the same patient population in your group, and you want to be aware that how many patients are referred for these studies and what proportion of them are likely to qualify for your particular study. Also be aware of obsolescence. So, for example, if you anticipate that a drug that is going to change the treatment of your particular disease is going to come on board and get FDA approved within the next 6 or 7 months, you have to realize that that's going to create serious problems with recruitment for your for alternative treatments, because an FDA approved medication is not going to have the problems of having a placebo arm. You have to, if you are the only site or one of the few sites, you want to make sure that there's statistical power. You want to know that you have the correct patient population. So you have the correct disease, that, within that disease, the subtype of the disease that you have responds to has the target for which the medication is designed, and that you have the correct endpoints that you can measure, and that the patients within your patient population or within your community are available and compliant. Can we go to the next one, please? Next page, please. Thank you. Now, in terms of how you can judge whether you have the appropriate resources or not, you have to think of several things. There are institutional resources, so it's a little bit easier. For example, if you're part of the Biggs Institute or the Cancer Center, or one of the other sort of larger clinical trial areas, say diabetes, where there are already staff, subjects, and there's a setting for recruitment. There's often an optimal window of time for you to be able to do this. Often, if you are the PI who's initiating something, certain drugs and certain ideas become sort of trendy and chic within your area of expertise, and the funding bodies are much more likely to give you time and money for those. And then there are intangibles. Are you a trusted institution within your community? Do you have a good reputation? Do you have good media relations? And also the nature of the disease. Certain diseases, especially ones for which there are not many alternative treatments, are easier to recruit for. Next slide, please. So this could be roughly the model of recruitment. So you have a community out there. You want to educate them by having websites and brochure, advertisement, PR events, community events, and what's the best for clinical trials? We'll come back to that. So you can either have referral from the community, in which case you need to have a good relationship with people who are, referring, patients to you, or if you have a large tertiary clinic, that's often a very good recruitment center as well. For larger programs like ours at the Biggs, we also have a research clinic where individuals need not be referred to our clinical services for them to be inside one of the trials. Now, the next thing is pre-screening, because often there are a couple of things, including the stage of the disease and the age of the person and the presence of contraindications that quite easily rule out many patients without having to do a full screening. And that pre-screening can be done by recruitment staff or volunteers or postdocs or students who are working with you. And once you have permission from the patient and the family to contact them, they contact them, go through a brief record of things that can quickly rule in or rule out. If the pre-screening is passed, then there's the full screening where you go through in detail through the inclusion and exclusion criteria. It's always good to have a screen failure database because a patient that might not be perfect for one study is likely to be appropriate for another study. So keeping, with their permission, keeping track of patients who do not qualify, can be very helpful. Next. So you have to realize that recruitment and clinical trials, they're messy. Often you have periods where you're going to have a lot of people wanting to enroll and call your center. Other times where you're sort of struggling to attract any recruits. Therefore, you have to use multiple strategies. And these multiple strategies could be everything from sort of educational things, as well as jumping onto news items. So a new medication comes on board, or there's a PR release from the drug company. You can easily sort of go on the local news and drum up some business. You want to maintain flexibility. Clinical trials are about people, and you want to make it easy, acceptable, and rewarding for the people who are participating. You're not running a wet lab, where standardization would sort of overtake the interest of the subjects that you have. So a certain degree of flexibility is important. You have to have milestones to make sure that you're not falling behind, and you need obviously enough funding and resources to be able to recruit the individuals. There's certain inbuilt barriers to success. It could be characteristics of the experiment. It could be the concerns about dangers. These are either real or perceived. If they're real, then you need to think of a different way of doing it. If it's perceived, then you can do reassurance, education, supervision, and try to have risk mitigation. If there's a lack of health benefits, especially say in observational studies, then you want to explain an appeal to the philanthropy of the individuals who may be involved. If you have a lot of screen fails, often you would want to go for massive recruitment drives. So, for example, one of the studies that is struggling to recruit is a study called the AHEAD trial around the country, where you have to find individuals who have amyloid pathology in their head but no symptoms. And this is difficult because people without symptoms often don't refer themselves to clinics. And therefore, when you screen about 100 patients, you get at most 2 or 3 patients who might qualify. So one way of going about it is, and we've done this a couple of times, gone on television and sort of had all hands on deck, so that individuals will call. Within the 2 or 3 days of being on television, you are going to get 200, 300 people calling in, and you take the details, and then you take your time going through them and try to sort of recruit them. People are concerned about being in the placebo arm, so crossover design and having an open label period after the definitive trial is finished is often an incentive. You try to make it as easy and convenient for people to do it. You want to make your own structure, so the individuals within your clinic, the way people interact with the research staff and so on, as easy and seamless as possible. And give yourself a lot of time. Don't overestimate how many people you can recruit, and you always can recruit more rather than less. If there are delays in starts, that can sort of really upend your plans. So one of the things that you often do, always over plan for the preparation period of about 3 to 6 months in the beginning. And you can ask for extensions, especially if you are yourself initiating those trials. You monitor where you are with regards to the recruitment, and there are various ways you can do this. I mean, the ideal is one that is closest to that red line, or above it. So if you're lagging in recruitment, then there are a couple of things you can do. One thing is you can sort of either have educational sessions with people who refer to you, often primary physicians in our case, or neurologists in the community. You can send them information of how they can refer for these studies. Sometimes it is actually helpful for them, because if there is no alternative treatments, that they say, well, there's no alternative treatment, but you can go into this experimental treatment and see if it helps. You can try to extend your referral sources. You can have community events, and especially we find that this is of special interest in the San Antonio community, to build trust. When we have many Spanish-speaking staff who are very well versed and very competent in what they do, and when they go to the community and they see people face to face, and they speak to them in their own language, and they're able to project that feeling of competence and care, we find that that's probably our best recruitment. And we recruit, in terms of the percentage Hispanic population that we recruit, we're one of the best in the country. Here, say at Biggs, even compared to places where the demographic and the number of people of Hispanic background are comparable. You can go to EHR and try to see patients that you've already been in your clinic that might be appropriate for recruitment, and you can also give financial incentives, as well. So these are the practical things that you can do. Now, somebody asked me what's the best program for doing clinical trials. To be honest, I don't do the statistics for these studies. The largest studies that we do here are usually either national or commercial, and the smaller ones that I'm involved in, so the proof of concept, original thinking, which we are pursuing in the areas of neuroimmunology and areas of aging, which is not what most of the field is looking after. We are at the stage of phase 2A, 1B, 2A, which are proof of concept pilot studies, which don't require a lot of statistical power. You just need to sort of get some preliminary data. So we have statisticians is the bottom line.
Thank you, Dr. Salardini, for being here for this session. We really appreciate it. Dr. Salardini does need to log off pretty quickly here. We might have time for just one or two questions. I did see in the chat that we had a question about what was the best statistical program for clinical trials. Dr. Salardini, do you have any opinions about that?
No, so what I said is that we have different, we have statisticians, and different ones do different things. So, they're at the level where they use either R programming or Python, and those are not things that I have any facility with. And for my purposes, I'm more of a mechanism sort of person. So we do mostly pilot studies, and we don't need power analysis for those.
Terrific, thank you. Does anybody else have any last minute quick questions for Dr. Salardini before we let him go? You can feel free to unmute yourself if you have something to ask.
I can tell you one thing, that if you want a really easy program that you don't need to know a lot of statistics to work with, the one that I like is JMP.
Terrific, thank you. Any other questions for Dr. Salardini? I'm not seeing anything and I'm not hearing anything, so let's go on. Thank you again, Dr. Salardini, for being here.
Thank you so much.
We'll let you go.
We
will go on with our presentations. Our next speaker is Dr. Ramirez. Dr. Ramirez, as we mentioned earlier, is the chair of the Populations Health Sciences Department, and she is here today to talk to us about the need for better representation in clinical trials, how to make sure that you've got a diverse audience or diverse participant pool, let's put it that way, in your trials. So Dr. Ramirez, please take it away.
Great. Thank you so much, Krista. And it's a pleasure to be here with all of you. And I did want to address the last question in terms of statistics. I am the chair of Population Health Sciences, and we do have a biostatistics division. Dr. John Gelfond is the director of that division, and we do provide a limited amount of some free services. So if you should ever need any help, please feel free to reach out to them and for any statistical needs. So just a little plug there for them. I also want to have a disclosure. One of the projects that I'll be briefly mentioning is funded by the Genentech Foundation. So I just wanted to share that up front. My background is more in the behavioral research area. So all our studies are really kind of dealing with what is it that we need to do to motivate our population to participate in clinical studies? And that was so nicely described earlier, what I'd like to mention is oftentimes the researchers do not realize how important it is to focus on the recruitment side as well as the design of their study. And oftentimes they don't think about the diversity of the representation that they would like to see in their clinical trials. And some trials require a little bit more work up front to actually get your population to participate in, because they are not knowledgeable about what are clinical trials. So I'll be sharing a little bit of that information for you all to consider as you design your studies in the future. The next slide. Again, most of my time I work within the Cancer Center. I'm the Associate Director for Community Outreach and Engagement, and I work with all our researchers, as they, to inform them about our community needs, what are some of the areas that need to be focused on. And one of the things that I've been working on lately is the underrepresentation of Latinos in clinical trials, that even though our Latino population represent almost 20% of the US population, and here in South Texas, we represent almost 69% of the population, but our numbers are not as good when we're offered clinical trials or treatment trials for our community. And nationally, they through NCI trials, less than 10% of are represented in the NCI trials. And when you get into the Food and Drug Administration type trials, less than 4% of Hispanics or Latinos are represented in those clinical trials. And some of our research has shown is that some of the barriers that we see is truly a lack of awareness about what are trials. Why do we use the word trials? You know, in our community, sometimes they think it's more legally related, you know, something to deal with an offense of some kind, and that you're going into a trial. So sometimes we have to be cautious in terms of the wording and the language that we use about clinical trials. Also, there's just a lack of knowledge about the disease. You know, our community doesn't want to feel like they're a guinea pig, and why wouldn't you want to give them the current treatment? And so again, that knowledge about what is a trial and how the trial is designed to use the current medication that's available, or perhaps something that's even better. And how do we communicate that? Are we making sure we're presenting the information in a cultural way, in a literacy level where it's easier for them to understand? And sometimes one of the biggest barriers is that our informed consent forms haven't even been translated into Spanish or for utilization in a population that you're trying to recruit. So these are things now that some IRBs are requiring you to have specific formats and back translations and so forth to ensure that your informed consent is truly reflective of how to best communicate with the audience that you're trying to reach. And other barriers include a cost. Many of our Latinos in the Latino community, about 20% don't have health insurance. And so sometimes they don't have the coverage that's needed to cover some of the basic information that you need for clinical trials. Or if they're offered a trial, have you made any accommodations for them to be able to come to your site to either, draw their bloods or to provide them with the treatments that they need and so forth. So a lot of these are things that we need to consider as you design a trial. But some of the good things that occur is that if they have a good rapport with their doctor, if they are knowledgeable of the trial center, that is really important, having that trust, especially now coming out of COVID, ensuring that you have a good trust within your community that you're trying to recruit from is extremely important. And also that sharing with them that yes, the treatment may not necessarily work for them, but they are helping the future, their future for their own family members and the future in getting better and newer treatments that are more effective. And again, just making sure that, as was stated earlier, your recruitment information is clear and is easy to be informative for the patients. And also sometimes we have found within the Latino community, the family may be the barrier. So when you're talking to the individual, make sure that you're as inclusive as possible and also include the family member, where appropriate. In the next slide. So I wanted just to share with you something that we did at the Mays Cancer Center. We've actually developed a committee that looks at the clinical trial accrual for underrepresented populations. And what we try to do is to work with our researchers to find out, have you identified any barriers of why these groups have not been involved? Maybe you need to do a focus groups. That's a group where you bring a small group of individuals to talk to them about the illness that you're trying to treat and get opinions from them about what might be effective ways of recruiting them to participate in the trial. The importance of working with your clinicians and encouraging them and educating them about the clinical trials that are being offered within your clinic. And then most of all, reaching out and educating the community, as was described earlier. But for the Cancer Center, we instituted what we called a mandated minority accrual plan, to make sure that the clinical trials were going to have equitable representation. And the reason for this is the National Cancer Institute, it mandates that of us, if you receive funds from the National Cancer Institute, and if you're an NCI-funded cancer center, you have to make sure that you're listening to the needs of your community and that you have that they're well representative in your trials. So we help come up with a clinical investigator checklist of different types of approaches and tools that they could utilize, we have a person kind of designated to be available to help and address some of those issues with our researchers at the Cancer Center. And what we found by being a little bit more upfront about what's needed, that we were able to increase better representation of our Latinos in clinical trials, going from 42% to 49%, but still not quite representative of the population as a whole. And people ask us that, and it says, well, Latinos tend to be, a little bit younger, therefore maybe they're not being diagnosed with cancer just yet. And so that, sometimes you can't have that equal exact representation, but you need to show that you're doing the best that you can. On the next slide. And so our research team thought a lot about what is the best way of getting information into our population group. And so we developed this program that was called Choices, because in talking to clinicians, we know that your clinical time is very limited. And so if you have to start educating your patient from the very beginning about what is a clinical trial that might be appropriate for them, there's a lot of information that needs to get transferred. So we developed an online video and booklets, and then to educate our patients while they were in the waiting room about what were clinical trials. And we also introduced them to a community-based health patient navigator, not necessarily an RN level patient navigator, but someone who was trained from the community that could relate to the patients that we're trying to serve. And the whole purpose of this program was really to help the patient make a more informed decision about participating in a clinical trial. So the specific aims of the program was, providing them with the knowledge about the trials, trying to impact their attitudes of how they felt about towards trials, and giving them some information that would increase their self-efficacy, that if they were offered a trial, that they would be willing to discuss it further with their doctor or with their family member. Next slide. And so what we found that this was truly an effective way of going about it. We were, when we compared our intervention group to the control group, we were able to increase perceived understanding of clinical trials. What does randomization mean? And that we were also able to increase consideration of participating in a treatment trial in our treatment group. And it also, there's different stages of change, where someone may not have had any information, now they have a little bit of information, to someone who has good information and now they might be ready to take the next step. So in each of those levels of stages of change, we saw an increased significant difference that we specifically help our patients be ready. So when a doctor or a research nurse might offer a clinical trial to them, they would be more open to saying, oh, okay, I know what you're talking about, and I want to consider this. So we were able to document that computer-based videos were an effective strategy for increasing knowledge and understandings regarding clinical trials, and promoting potential participation in the future. Next slide. And a new thing that we are implementing as part of our community outreach and engagement program at the Mays Cancer Center is we're doing two things. One is that we're going throughout South Texas, and Dr. Rebecca Jones within the Institute for Health Promotion Research is helping me with this. We're doing listening sessions with our community members to try to better understand what are their needs, what is their cancer burden, and what are some of the experiences that they have gone through. I'm sure most of you have heard that, conveying a story certainly is a much more effective way in helping people better understand what you're trying to describe and make a difference with them. And then the other approach that we're taking is design studios. Again, when our researchers are designing a program, we want to make sure that they also have the voice of the community. So this is a process in which a researcher will come to us at the very developmental stage of their proposal. Maybe they just got awarded, and they'll come to us and say, we would like to ask the community about where's the best places to recruit, or the best places where we can place our information, or what should be involved in our messaging as we're recruiting for this study. And so we'll have a panel that we recruit from the community that will listen to what the researcher has to share with them. And then there's a dialogue that goes back and forth. So we really have a true bidirectional communication that is going on. And that way the researcher, before they get too far along, they've now incorporated, some information that that makes sense to the community. Therefore, when they begin to hear about their particular trial or study, the community or the individuals that it's designed for will be much more receptive to moving forward with them. And then the next study that we're doing, if we can get the next slide, is actually funded through the Genentech Foundation. And this was an approach to take actually a dual approach. One is how effective can we be utilizing social media and educating our community about clinical trials. And so with this, we created not only role model stories, we found individuals who would be willing to share their story about a clinical trial. We've shown some short YouTube videos, and then tools that we utilized and have disseminated through our network now that has grown to over 500,000 of individuals that represent family members, researchers, community leaders, all sorts of individuals from schools and so forth, and students are part of our network, and they come to this to learn more about information that could be useful for them and for their patients and for the community. And this is a combined both web-based, social media, and email partnerships that we have developed. And we're finding this to be very useful. So like when we're recruiting just kind of for the Mays Cancer clinical trial, we obviously do a little bit of geomapping and trying to find out, what census areas do we want to reach in our Bexar County area. So you can go to our website to saludamerica.org to learn a little bit more about that. If we can go to the next page, please. And so these are just some examples that I wanted to share with you. For example, we make sure that we're promoting the information that we promote is bicultural, and we work it in many different ways. One, we reach out to our clinicians who are Spanish speaking and ask them to provide their information both in English and in Spanish so that we can share this with our participants. We develop infographics for them that they can use. And then we also have developed, webinars on different topics on clinical trials. And when we do the webinars, it's not only experts, but we also always want to try to include a patient, a clinician, individuals who are important in conveying the information that we want. And so there's different types of studies, right? There's clinical trials, but sometimes there's biospecimen type studies. Right now, we are working with the All of Us program. They reached out to us based on learning about us through Salud America and asked us if we would be a partner with them in informing, one of the largest studies to collect not only behavioral and information, but also biological information and full electronic medical records. And their goal is to reach over 1 million individuals, but they want to make sure that they have a diverse sample. So they reached out to us to help amplify their message and to help recruit more Latinos into the All of Us program. On the next slide, you'll see another important, so it's not only cultural information that we've got to get across and present that in a way that is understood to our community, but what kinds of trials are we promoting? Right now, clinical trials are getting very sophisticated in terms of the treatment side, right? Some trials that are available need a very small number of people because they have to have X number of characteristics in order to participate in that trial. So as our former speaker mentioned, what is your eligibility criteria? I like larger trials, so that we can truly show that and test our different approaches for recruiting, but the trials then, they're more like what we call phase 3, and phase 4 type trials that are ready to be tested on a larger group of individuals. But for example, here at the Mays Cancer Center, we promoted the PASS clinical trial that focused on breast cancer outcomes. Right now, we're doing a study on identifying Latino not only breast, but Latino cancer survivors. Our job is to recruit 1,500 cancer survivors. And our first approach was to identify those that were eligible through our electronic medical records. But now that we've pretty much gone through our database, and this was identifying cancer survivors for 5 years or more post being diagnosed with cancer, we're having a harder time. So now we really have to reach out into the community, but then to truly find out if our patients are eligible for our trial, going to require a little bit more from our RAs. So we were really good at recruiting maybe about 15 eligible participants per month, but now we got to bump that up to 30. And now that we're having to go more towards the open venue and recruiting from the community, that takes a lot more work. So we're moving forward with that. But it's a great trial. If anybody knows of anyone who might want to participate, please send them to us. And then we also helped with the chirotherapy on breast cancer and promoting that trial as well. So these are just different examples of trials that are existing today at the Cancer Center. The next slide, please. And so the third is, as I mentioned earlier, is the importance of uplifting stories of successful role models. And you might ask, why is that important? Well, if they see someone that looks like them and that they were successful in participating in a trial, that person says, you know what, maybe I'll give it a try as well. So it's our way of increasing their self-efficacy and showing that these are real people who have gone through it. We didn't pay for role models. We didn't pay for an actor to give you that message as you might normally see on television. But this is a real person who had cancer and who actually went through the trial. And so we've been very successful in utilizing this approach. On the next slide, though, is something that we need to be aware of. As healthcare providers, some of us may carry biases that we're not aware of. So we've also wanted to make sure that we educated our providers and say, hey, are you being as fair and as equitable as possible and offering trials to everyone who might benefit from this trial. You know, and what we found in some prior work is that there was some decisions made about, oh, that person's going to have, you know, travel barriers, and so therefore we're not going to offer it to them, or their insurance is going to give us a headache, and it does because they don't have insurance, and so we'd rather not offer it to them. But is that fair? You know, we have to grow the extra distance to make sure that we are offering trials to everyone who might benefit from the potential solutions. So if you know of anybody who might need to work on this, please have them. These are one of the tools that we developed under Salud America that has been very useful. So please, you know, spur them to action and focus on that if they should need it. Next slide, please. And then last but not least, we also focused on webinars, and these are just some of the topics that we worked on. Is how do you encourage Latinos to participate in clinical trials? How do you overcome implicit biases that might be out there? You know, why should you think about participating in a trial? And then also trying to address myths and misconceptions that are out there about trials. So these we found to be very effective in communicating. And after we had each webinar, we found that our attendance was getting higher, you know, not only from the community, but also drawing other individuals who were interested. All of these have been recorded in case anybody would like to go and preview any of them. And then I just have a couple more slides that I'd like to just say, you know, some things that we have learned in terms of recommendations. Again, the trust with the community is so important, and having someone that looks and comes from the community and educating them how they can either become a community health worker for you to impart that information is very important. And we found that especially this was true during COVID. It was really instrumental that we already had this network of individuals that we could utilize to get our information out. The second is that the importance of patient navigators, because at this community level, again, a different way, well, mainly because they could help you with follow-up phone calls, they could help you text the patients, they could help maybe go and visit the patients at their home. They might have more flexible hours, and they might be able to develop a better rapport with the Latino, the family members that you were trying to reach. So these are just some things to consider as you're planning your recruitment strategies. And then the next slide is, you know, we have found that social media can truly be an effective way in promoting clinical trials. It's an effective way of dispelling misconceptions, because we got to counter the misinformation that's out there. And then it's a new way of engaging more community members and representation. And also that the opportunity to embed some of our social media information with educational videos, short, sweet, and to the point, you know, but utilizing them in a very culturally and tailored way have been very informative for us. And again, the utilization of role models. I can't emphasize that, using real people who can talk about what they've been through and how successful it was for them. So I hope this is helpful. And I just want to thank you. We've got a great team there at our Population Health and Sciences Department, as well as the Institute for Health Promotion Research. So I'll be glad to take any questions.
Thank you, Dr. Ramirez, for all that valuable information. I'm afraid that we're running short on time, so I rather than taking questions right now, I'm going to go ahead and move on to Dr. Tripathi. I know we're running short on time here, folks. If you can hang on, I'll give Dr. Tripathi as much time as he has to be with us. You hang on if you can. If you can't, please feel free to log off, and the recording should be available shortly. So Dr. Tripathi, please take the stage.
Okay, thank you, Krista. Sorry, I had a clinic in the morning, then there is another clinic in the afternoon. So I'm afraid I have to leave shortly. But you already heard Dr. Saladini and Dr. Ramirez, they give an overview about recruitment for clinical trials, and particularly Dr. Ramirez, how to include a diversity in the population. So I will skip most of my talks in general terms, but I'll go straight to, so I am an endocrinologist, internal medicine doctor in the VA. So I do clinical trials, mostly pharma-sponsored and also some NIH investigator-initiated trials. And I focus mostly on patients with diabetes and cardiovascular disease. So go to the next slide. Yeah, so the key is you have to find the eligible patient population. That's the most important, and only sign up for studies. For example, I'm a diabetes doctor. If I sign up for a patient style with asthma, of course, I'll never be able to recruit them. So just sign up for studies in which you believe you have access to the study population. And then, of course, you need to have a coordinator who is properly trained, educated, and knowledgeable, who can explain because the coordinator is the first point of contact with the patient, with the study subject, and she should be able to explain the study clearly in simple terms to the patient. And you should be confident of recruiting adequate number of patients as promised to the sponsors. Although it's always we tell the sponsor we can recruit, even though I have been doing for 20 years. Currently, I have 2 studies which I'm struggling to recruit. So it's not always easy to find, with the new treatments available, so many choices, it's not always possible or easy to recruit. Okay, so the next. And also, I'll just give you some guidelines. What has worked for me for retaining study participant till the study completion? And the next, yeah, so we can go to the next slide. And I think we can skip this recruitment strategies because this has already been discussed in detail by Dr. Saladini. And just to give an example, like why people say they want to participate in clinical trials. Some, actually, I was surprised to see that about 40% have altruistic. So they say, well, it may not help me, but it'll help the next generation. And in fact, on the veterans, a lot of them say that, yeah, it will help other veterans. And some say they have monetary compensation. Some say they'll get access to newer treatment, which they do not have insurance, so they get better access. And some say they need to learn more about newer treatment. So the next. Okay, so this is the key that what has worked for me. Once you enroll a patient for a clinical trial, and it's very important you keep them engaged so that they do not drop out in the middle of the study. And I'll come to the number of reasons they drop out. And because I see patients in the clinic also, so most of the patients with diabetes and heart disease, I try to see them in my clinic also. That way I take care of the clinical problems in diabetes and also take care of the participants in the clinical trials. And they have easy access to me and during the trial, and regardless if they do the trial or not, they have access to me. But that helps them. If they run out, they need a refill or something, they always can contact the coordinator who contacts me. So that way they feel that they're more accessible to the physician. And that has helped me in retain patients. And most of my patients, with those who participate in the study, they come back for repeat study. And also that helps in frequent contact with the study participant, and my coordinators and my staff and myself being in frequent contact, I see the retention rate is definitely higher if you are in close contact with the study participant. Okay, so I'll go to the next one. So again, the reasons for dropout, like if you recruit a patient who comes really far and he has to come fasting early in the morning, it will not be feasible. So you have to take into account how far the patient has to come and what the study requires, if he has to come fasting or not. And then there is scheduling conflict, which patient is a full-time job and you do not have an afternoon appointment, that will also have difficulty. And then of course, the other personal and family matters are there. And then patients coming in a wheelchair or has some mobility issues and he needs a transport, that may not be able to continue the study. And of course, the financial restraint is there. Some of them say, hey, I do not have money for my gas, so but usually I do not encounter this problem much in my experience. And of course, there's some patients say if you have to make sure the coordinators and the physical staff need to appreciate the help because the patients are participating in the clinical trial. Some it is purely voluntary, and some of them may get benefit or not. The staff must appreciate the fact that why the patients are doing all the study participants doing clinical trials, and that helps in retention. And of course, we have to send them reminders. But nowadays it's much easier. You can send them text message, hey, Mr. So-and-so, you have a visit coming up to next week or the date exactly. That helps in retention. And another major thing is, which is I've noticed that if there is a placebo arm and you recruit somebody for diabetes and weight loss, they say, hey, I'm not losing any weight, my diabetes is not improving. And that may be another reason to drop out. But if you are the treating physician, you can start some other treatment which may not affect the study, and that can help you retention. And the side effects, another, of course, that you do not have any control. If there is a major side effect, the patient will drop out. That's beyond your control. And there's some patients, I had a patient recently, there's 2 arms of the study. I don't know how the sponsor designed the study. One was a pill, one was an injection. Of course, if the one who gets a daily injection, the compliance will be low, and it takes a lot of effort to keep somebody, persuade somebody to keep in the study, which is a daily injection, versus somebody at the other group gets only a pill. So it takes a lot of efforts before somebody signs up for the study. You must explain them clearly what they're signing up for. Okay, thank you. Okay, again, misunderstood expectation. Somebody think that, well, I'll start this weight loss study, I'll lose 30 pounds in a month, and that may not happen. And you must clearly explain the expected results, what they expect from the study medication. They should not have an unrealistic expectation. Okay, so I'll go to the next slide. And again, the protocol design is beyond our control. If it's a pharma-sponsored study, if the study is designed by the sponsors, it's not a complicated protocol. That's beyond our control. We try our best, explain the patient what the study entails, how many visits, what is the time it will require. And as I explained before, set the expectation up front and tell them what the expected side effect, what are the possible benefits versus the risk versus benefits. And some may say, sorry, I don't want this. And some may say, well, I'll keep trying. So you should be very clear in the beginning, tell the patient what the expected benefit versus the risks. And always explain the importance that we are really grateful for them participating in the study. That may not help them, but in general, it will help in the approval of a new drug, which will help in general for that disease condition in future. And always, if the patient has a question, you should make sure that the patient has access to any of the study team, either the coordinator or the PI, to respond to their queries immediately. That helps them to continue to participate in the study. And as I mentioned earlier, that's 10 pointers for upcoming visits. So, and provide a comfortable, patient-friendly environment. Like you have research unit, which is patient can talk to the patient in privacy and without any interference. That helps. So this is an overview of what has worked for me in the VA, the recruitment, particularly here in the VA. I can tell those investigators who are interested in those studies in the VA that there is a process here. If you apply for a research at the VA, you can get that. So before you get the approval, there's a screen the database from the IT support. They can, if you give the inclusion exclusion criteria, they can screen you patient, give you a detailed list of patients who are potential meet your inclusion exclusion criteria. They may not be your patient. Then after you get I'm just not part of this slide, I'm just telling in general about how to help recruitment in the VA. And once you get a list of the patients, then you can, as per the VA guidelines, you have to send a opt-out letter that the patient's You send a letter to the patient saying, hey, we're applying to do this study, we'll contact you. If you do not want to be contacted, let us know. So if nobody contacts you back, then you can do a call them. Otherwise, you cannot do a cold call to any patient. So there's an opt-out letter. And based on the list, you can, although you should be prepared to get rejections. Out of 5 or 10 patients you call, maybe one will agree to participate. So it requires a lot of patience and a lot of effort in terms to get patients in the study. And so that is one resource. And other is that in the VA, you can always go to the clinic, like a diabetes clinic or the oncology clinic or primary care clinic, and put flyers there or talk to the physicians or the nurse practitioner or other providers there. They can help you recruit. And in general, my experience in the veterans have been that they have been, the follow-up in veterans, I have done studies at Texas Diabetes Institute as well. In general, my experience is that their follow-up is much better and they show up on time, and the dropout rate is in fact very low. So this is what has worked in my case in veterans and recruitment and as well as retention. It may not work in other cases, but for veterans, this is what worked. And if anybody is interested to know more about how to enroll veterans in their studies, you can always contact me. And I'm part of the Foundation of Advancement of Veteran Healthcare and Research, and I can give you more information. I think that should be the last slide, I think.
It is the last slide. Thank you,
Yes.
Dr. Tripathi. We appreciate you staying with us a couple minutes over to give us all that valuable information. I think you brought up a bunch of really good points that will be valuable for our participants. And with that, I apologize that we've gone a little bit over. We don't really have time for extra questions,
Okay.
but please, if you have questions, either contact our speakers directly or send them to us here at the Clinical Trial Scholars Program, and we will forward them on and see if we can get some answers for you. Thanks to everybody on the call who was here and was with us through this series. Please do fill out your post-session assessment that'll pop up when you log out of the Zoom call. Make sure that you have your modules completed or your sessions completed. If you are interested in that electronic badge, let us know if you have any trouble doing that. There's also going to be a post-program survey that's going to be sent out in the coming weeks, so please respond to that when it arrives. On behalf of Danny Gordon and the Office of the Vice President for Research, thank you, all of you, so much for attending, taking the time and effort to participate in our program. We hope it's been helpful for you, and we look forward to seeing your future clinical trials in the research administration offices. Everybody have a good afternoon.
Thank you. Bye.